Imagine getting your child's blood test results back, and you see a lot of numbers with words like normal or high next to them. It can feel a bit overwhelming, right? You might wonder what all these values truly mean for your child's health. Child blood test reference ranges are simply the expected values for different substances in a child's blood, specifically tailored to their age group. They act as a guide for doctors, helping them understand if your child's individual results fall within a typical healthy spectrum or if further investigation might be needed. These ranges are a crucial tool in pediatric care. Now, why are these ranges so different for children compared to adults, you might ask? The fundamental reason is that children are not just miniature adults. Their bodies are incredible engines of growth and development, constantly undergoing profound changes from the moment they are born through adolescence. This dynamic process means that almost every physiological system, from their blood cell production to their organ function and hormone levels, changes dramatically over time. For example, a newborn baby has significantly different blood counts than a toddler, who in turn has different values from a 10-year-old. These differences are normal and expected for each developmental stage. Factors like your child's specific age in months or years, their gender, and even their stage of pubertal development, if applicable, can profoundly influence what is considered a typical range for many blood components. Think about it this way. A 5-year-old is building bones and muscle at a rapid pace, which might affect certain enzyme levels, while a teenager is experiencing hormonal shifts that will impact other markers. These specific pediatric reference ranges are not just arbitrary numbers. They are meticulously established through extensive scientific studies involving thousands of healthy children across various age groups and backgrounds. Scientists and medical professionals analyze data to determine the 95% statistical window where most healthy children's results will fall. This rigorous process creates a reliable, age-appropriate guide that allows pediatricians to accurately interpret your child's lab work. Without these tailored ranges, a doctor might misinterpret a perfectly normal result for a child as a concern, or conversely, overlook a subtle sign of an issue. So, how can you best use this information as a parent? First and foremost, when you receive your child's blood test results, remember that the numbers should always be interpreted using these specific pediatric reference ranges. Do not compare them to adult ranges, as that can lead to unnecessary worry. Second, and perhaps most importantly, always schedule a follow-up conversation with your pediatrician to discuss the results. They are the best resource to interpret these numbers in the full context of your child's overall health, their medical history, any symptoms they might be experiencing, and their unique developmental stage. Your pediatrician's expertise is invaluable here. Here is an interesting insider detail. Some blood components, such as alkaline phosphatase, which is an enzyme involved in bone growth, can naturally be much higher in growing children than in adults. This is because their bones and tissues are rapidly remodeling and developing. A value that might be considered abnormally high and indicative of a problem in an adult is often perfectly normal and healthy for a child experiencing a growth spurt. Knowing this can help parents avoid unnecessary anxiety when reviewing results. This nuanced understanding provides a much clearer and more reassuring picture of your child's overall well-being. By understanding that child blood test reference ranges are specially designed and tailored to account for the unique, dynamic stages of child development, you gain a powerful insight into your child's health. This knowledge empowers you to confidently engage in more informed and productive conversations with your pediatrician. Ultimately, this understanding helps ensure that your child receives the most appropriate and precise care, always keeping their unique growth journey in mind. It truly helps you be an informed and proactive partner in your child's health care.